do have an aging nursing workforce, and the demand for nursing care continues to rise with our aging population. So it's just another reason why we need high-quality nursing education programs like Reynolds Community College. And I can share with you where I work and where I have the privilege of working with nurses every day. I can't walk down a single hall in a single nursing unit, regardless of the shift, the day of the week, without running into Reynolds at one time. Hence why it's important for us that we have this connection with Reynolds to take good care of our patients here in our community.
My name is June Quisenberry, and I'm a 1958 graduate of the Grace Hospital School of Nursing that was located here in Richmond, Virginia. Our Alumni Association is one of the benefactors of the Reynolds Scholarships for Student Nurses, those seeking an RN education. Now, when I began my nursing education at Grace Hospital, RPI, and MCV, my tuition for the entire 3 years was $300. And let me tell you what that covered. Housing, meals, books, uniforms, shoes. And then when we started doing our clinicals in the hospital, they paid us $15 a month for spending money. It was great, but times have changed. And I know that $300 probably would not even cover the cost of a textbook in today's world. Patience, compassion, and strength are tomorrow's future in the nursing field. And I want to remind you right here that when you're 100% in that nursing field, no matter what you're doing, remember to give back. Give back to your profession. Give back to your school. It'll make you happy.
I first came to Reynolds in 1999 when I moved to the Richmond area. I had a few ideas of what I wanted to study, but took my time to obtain my associate's degree in social sciences to truly make sure. Upon completing my associate's, I decided I wanted to become a nurse. Truthfully, it had only been in the past few years that I've realized, though, that then I knew that I wanted to be a nurse, but I didn't know why I wanted to be a nurse. Now that I have realized that, a whole new world has opened up. Although I completed all the pre-nursing courses, I did not apply to the RN program at that time. I had met the love of my life, Dustin, and chose to get married and focus on our life together. All was bliss until we were 5 months pregnant with our first son. My husband was told one word that rocked our life forever: cancer. Dustin carried through with radiation, a surgery which left him without his right eye, and nights of sickness and fear. We were blessed with another word only months after my son was born: remission. On the wings of that amazing word, we had our second son 1 year later. Alas, that joy and amazement was crushed again. Cancer. Although this time there were additional scary, uglier words: metastasize, terminal. I looked at Dustin, and we knew we would be in for the ride of our lives. 2.5 years later, or for the next 2.5 years, we were in and out of offices: oncologists, radiologists, orthopedics, surgeons, and psychiatrists' offices. We were in hospitals for scans, procedures, surgeries, chemotherapy, radiation, lab work, and palliative care. MCV and Massey Cancer Center became our home away from home for me and my husband, as well as my 2 babies. But the thing that stands out the most, the amazing and beautiful silver lining, was that I witnessed some of the most truest compassion from the nurses. I remember times when I would break down at my husband's bedside, and an RN or care partner would take my sons to the hallway to entertain them. Another nurse brought them coloring books. I saw nurses take serious grief from my husband when he was in pain. I saw nurses quietly tear up as they left our room. I received some of the most authentic, caring hugs from RNs. We lost Dustin on November 8th, 2012. It was the most heroic and heartbreaking thing I've ever been through. I miss him every day, but every day I thank him. Strangely enough, if it hadn't been for the adversity of that cancer, I still wouldn't know why I wanted to be a nurse. I now know exactly why I want to be a nurse. I want to give back. I want to offer every ounce of support I have in me. I want to offer solace in a simple hug. Although I may not be able to save each and every patient, I want to aid in their comfort, to offer any intervention that may give even a moment of relief. With this newfound focus and determination, I am ready to complete my education and continue on as a registered nurse. However, such focus can be short-lived when funds run dry and finances grow heavy, especially medical bills. I was strapped, unsure how to complete my focus of becoming an RN, and that is where the generous gifts from the Letty Payne Whitehead Foundation and EWI have come into play. Without the generous scholarships and vote of faith in my education, I may have lost my dream of giving back. The gifts given to me are allowing me to give back. It is a wonderful, beautiful cycle. I would not financially be able to independently pay for school while raising my two boys without the help of EWI and the Letty Payne Whitehead Foundation. There are not enough thank yous that I can state to truly express how grateful, humbled, and truly honored I am to have been given such generous gifts. These scholarships mean so much to each and every one of us students, truly. But I also look at it as a gift to my children and other recipients' families who now, because of generous donors, have a chance at an improved future full of hope and endless possibilities. Thank you for letting me share my story.